Our next speaker, nominated by President Biden, our guest was confirmed by the Senate and sworn in as the 11th Secretary of Veterans Affairs on February the 9th, 2021. He previously served as White House Chief of Staff for President Obama. During the confirmation hearings for his current position, he said, "There is no more sacred obligation nor noble undertaking than to uphold our promises to our veterans, whether they came home decades ago or days ago." He served in the senior staff positions in the House and Senate. He is a graduate of St. John's University in Collegeville, Minnesota, and earned a master's degree at Georgetown. Please give a warm American Legion welcome to Honorable Secretary of Veterans Affairs, Denis McDonough.
Thank you so much. It's an honor to be with you. Thank you, Bill, for that kind introduction, for your decades of service to our country, for your steadfast leadership as National Commander, and last but in no way least, for your work as the booming voice of the post-29 American Legion baseball team. Earlier this spring, a vet sent me a note, included in it one of this year's official Legion baseballs. My son and I play catch with it in our backyard almost every night. I'm a product of Legion baseball, post 491, Bayport, Minnesota, 1988. And having a catch with Teddy is a clear reminder of the role you play in communities and families across the country. When I look around this room, I see so many people deserving of our gratitude and recognition. Starting with Lieutenant Colonel Bruce Crandall, who received the Medal of Honor for his enormous courage and profound leadership in Uindrang Valley on 14 November 1965. May God bless you. The memories of Hal Moore and Joe Galloway, whom I know just passed away this month, and all those who fought at LZ X-Ray. I also want to recognize the Legion's National Adjutant, Dan Wheeler, all of the past National Commanders with us today, Navy Vice Admiral Yancey Lindsay, Sergeant Major Michael Barrett, Diane Carlson Evans, the Legion Riders, who just last week raised hundreds of thousands of dollars for children of disabled veterans and fallen service members. Hear, hear. And of course, all of you who have joined us today in person and online for the 102nd Annual Convention of the American Legion. 102 years. That's an incredible run. I want to thank you, all of you, for your service to the nation and for your devotion to veterans throughout the years. Now, we come together at a difficult time. In just 11 days, we will mark 20 years since the attacks on 11 September 2001. When our country was attacked on that fateful morning, so many young Americans, some of whom are here today, made the choice that so many veterans make at one point or another in their lives. They made a choice to run toward the fight, not away from it, to serve our country, to protect and defend our freedoms, to fight for and alongside their fellow service members, whatever may come. And yesterday, as the last U.S. troops flew out of Afghanistan, the war those brave men and women fought came to an end. I'd like to take a moment now to speak to those veterans and their loved ones, survivors, caregivers, families. I know that what's happened in Afghanistan over this past month has been incredibly painful for many of you. As you know, I'm not a veteran, but I've spent much of my life surrounded by and supporting veterans. In combat zones, I've seen your excellence in the grueling demands of deployment after deployment after deployment. At Walter Reed, I've been moved by the strength and resilience of our wounded warriors. And at Dover, as we were reminded painfully just Sunday, I've witnessed the unimaginable grief of military families as they say their final goodbyes. But there is no way that I can come close to understanding how you feel right now. There is no way that anyone who did not serve in Afghanistan, who did not fight in Afghanistan, who did not bleed in Afghanistan, who did not have loved ones who served and fought there, can fully understand how you feel right now. Because no one can unless they walked among the Afghan people the way you and your loved ones did. But there are veterans on your left and on your right and across this country who do understand and do get it. There are many thousands of veterans at VA who do understand too and are ready to help. And there are millions of people across the country who know what you did for them, who know what our fallen service members have done for them, including those who were tragically killed during the evacuation this week in Afghanistan. Their service, your choice to run into the fire matters, no matter what happens this month or any month. We are all safer for it. I thank you for all you have done as individuals, as an organization, as partners with VA, and as a veteran community to run toward the fight yet again, helping evacuate Americans, Afghan allies, and their families to safety. It has made a difference and saved thousands of lives. And while I cannot imagine what you're going through today or what you and your families have been going through, I want you to know this. We at VA are here for you. Your American Legion brothers and sisters are here for you. And the nation will always be grateful for what you did and sacrificed for us and for the burdens that you and your families continue to bear on our behalf. We are forever in your debt. You know, this difficult moment also reminds us of why we are gathered here today, of the sacred duty and mission that we at VA and the Legion share together. It all comes back to the fundamental promise our nation made to veterans of the wars in Afghanistan and Iraq, the same promise we make to anyone who signs up for military service. If you take care of us, we'll take care of you. If you fight for us, we'll fight for you. If you have our backs, we will have your back when you leave service. The thing is, our nation as a whole makes that promise. But we, at VA and the Legion, are among those most responsible for keeping that promise. Today, I'm here to give you an update on where we are in executing that mission and keeping that promise. But first, from the bottom of my heart, I thank you for all you do and all you have done in service of that mission for 102 years. It's a tough job, it's a difficult job, but it's one that you do so well. There is no more noble mission and no more sacred obligation. In some ways, that shared mission has never been more critical than during this past year. Tragically, at this convention, perhaps more than any other, it's impossible not to notice the empty seats of those who are no longer with us. When I think about the more than 625,000 people this country has lost to COVID, I remember that they are your people, our people. The veterans we served, the friends we want to call, the family members missing from our dinner tables. We remember those we've lost, and our hearts go out to those they've left behind. But it's also important to remember that there are so many veterans out there right now enjoying their summers with their families, or perhaps even sitting here in this room, whose lives have been saved or bettered because we worked together. Veterans like Billy Hurley. Like so many other vets and so many other Americans, Billy was struggling early in the pandemic. He lost his job as a bartender when COVID shut down the restaurant where he worked, and he had to go on unemployment. When that ran out, he got help from our Supportive Service for Veterans Families program at VA. But eventually he found himself in a position where he needed to pay 1 month of overdue rent. And he couldn't afford it. In his own words, he said he was broke, and he felt really down. Then he came to the Legion. He came to Ray Odom, a veteran service officer at Post 11 in Colorado. Ray helped Billy pay his rent and even offered to pay for his groceries. And now Billy has a steady job, and he says that when I walked out of the Legion, a big weight had been lifted off my shoulders. I felt refreshed, he added, like somebody had my back. The bottom line is that when Billy lost his job, VA was there for him. The Legion was there for him. We were there for him right when he needed it most. That's the type of work we do together. That's the power of our partnership, and it's been on display throughout this pandemic. At the Legion, you've helped weather the storm by collecting food for vets in need, giving blood, checking in on veterans through your Buddy Check program, distributing thousands of face masks, and hosting life-saving testing and vaccination sites across the country. VA employees have done the same, working overtime, risking their own lives to save the lives of vets across the country, ramping up telehealth appointments from 2,500 per day at the beginning of the pandemic to 45,000 per day a year later. So vets could get the care they needed even if it wasn't safe to come to the hospital. And mobilizing across America to get shots in the arms of more than 3.7 million people. All of that work, your work, our work, translates into the one statistic that matters most. Lives saved and improved by the work we do. In a time when veterans like Billy needed us most, the American Legion and VA rose to the occasion, and we did it together. Now, as we all know, our work on the pandemic is far from over. We've already lost thousands of veterans to this deadly disease, and now the Delta variant is causing an exponential increase in infections, hospitalizations, and even deaths once again. That's why everyone needs to be vaccinated. I can't say it enough. Almost every person dying from COVID right now is unvaccinated. In other words, right now, almost every COVID death is preventable. But don't take my word for it. Listen to the docs. A doc in Alabama told a harrowing story last month saying that an unvaccinated COVID patients are begging her right before they are put on a ventilator for the vaccine. But at that point, all she can say to them, all she can do is to hold their hands and say, I'm sorry, but it's too late. And days later, when she calls time of death for those patients, she has to tell their families that the best way to honor their deceased loved one is to get the vaccine. Because if they don't, that tragic story will repeat itself over and over again. I don't want that to be you or your family or the vets you know and love. That's why we've taken the extraordinary step of mandating vaccines for all VHA personnel who work in or visit our facilities. That's why I'm asking you now to please get vaccinated if you haven't already. And if you're immunocompromised and already vaccinated, it's why I'm asking you to please get your third shot at your local VAMC. More than half the nation's vets have already been vaccinated, and thanks to the Save Lives Act, all vets, their spouses, caregivers, can be vaccinated safely, easily, and free of charge. And fortunately, right now, you can get the J&J vaccine downstairs in exhibit halls 1 through 3. When you have a few minutes, please head down there. The vaccine is the only way to end this pandemic and finally return to normal life. But while we want to get back to our normal lives, we must also recognize that some things shouldn't go back to the way they were. At VA, for example, we shouldn't go back to the old way of doing things because the work we've done to respond to the pandemic has forged us into a stronger, better department for our nation's vets. Telehealth and teleappeals are allowing us to meet vets where they want to be met, when they want to be met, in unprecedented ways. Outpatient trust scores are among vets rose to 90% this year, which in my mind should be the floor, not the ceiling of what we do. Our team rated its 1 millionth disability claim faster this year than in any but 1 year in the history of VA, a result of our goal to make sure vets get their benefits on time, every time. And our cemeteries not only stayed open during the pandemic, but expanded to 6 new locations. The bottom line, we are now providing more care and more benefits to more veterans than ever before. So as we look to the future, we're not trying to build a VA that goes back to the old normal. With your help, we're going to continue to do better for our vets. We're going to continue to be better for our vets. And we're going to do that by driving toward the 4 fundamental principles of our vision: advocacy, access, outcomes, and excellence. First, advocacy. We're working to make sure the VA is the nation's premier advocate for veterans, their caregivers, their families, and their survivors. And when it comes to advocacy, it starts at the top. Our shared mission could not be a higher priority for this president, could not be more close to his heart. When President Biden nominated me to lead the VA, he told me to fight like hell for our vets. And that's exactly what we're doing. And the administration is doing the same thing, delivering for our vets with the Save Lives Act I mentioned earlier, with the American Rescue Plan, which allocated $17 billion to help us care for vets during the pandemic, and with the proposed reconciliation package that will provide $18 billion to help vets thrive in the future. But we all know advocacy at the White House level doesn't mean anything if vets don't use the benefits they've earned, which is where you come in. For many veterans, and certainly for some of our most deserving veterans, you are their first impression of VA, the front door to the benefits they've already earned. You're sitting across the tables from them or their surviving spouses or their dependents every day. All of which is to say the American Legion is one of VA's most important partners, and I'm committed to working with you every day to improve access for veterans. On access, we'll move heaven and earth to get veterans timely access to their VA resources. A major part of that equation is making sure that veterans have the best experience wherever they access benefits and services, at home, in the community, or at VA. That's why we're meeting vets where they are by expanding telehealth and teleappeals and by supporting our caregivers. Let me just say this clearly. Caregivers are not an afterthought for us, they are a top priority. That's why I've appointed Meg Cabot to be the VA's first ever senior advisor for caregivers, and it's why we look forward to expanding the program of comprehensive assistance to cover all caregivers as soon as possible. For vets who are getting care in the community, we are building a network that has the right providers at the right locations to meet their needs, no matter where they live. And of course, we're dedicated to improving the experience for vets who get their care directly from VA. That means finding the right balance between community care and direct care, putting the direct care system on a sustainable path to ensure that future generations of veterans enjoy the same great VA health care that past generations had. And it means rebuilding, repairing, realigning, and modernizing VA healthcare infrastructure to meet your needs, because that infrastructure is critical to the health of our nation's vets and to the health of our nation. VA is the backstop and innovator at the heart of the entire U.S. healthcare system, training America's physicians, researching tomorrow's challenges, and innovating today to overcome them. That is never going to change, and it surely won't change on my watch. Next, let me talk about veterans' outcomes. Outcomes drive everything we do because vets, not us, are the ultimate judges of our success. And there is no more important outcome than preventing veteran suicide, because one veteran who dies by suicide is one too many. Mental health services are critical for suicide prevention. So keeping mental health services going during the pandemic has been one of our primary focuses. Fortunately, vets have adapted seamlessly to telemental health, attending 4.4 million sessions already this year, more than doubling their total for all of 2020. We're also going all in on helping rural vets who need mental health services. That means building 3 new programs in rural locations to help severely mentally ill vets, and it means creating a new training program designed to attract top talent of clinicians to rural areas, to keep them in rural areas, and to care for vets who live in rural areas. And for anyone who may be struggling with the news of this month, we're here for you. Whether you want to speak to another veteran, talk to a therapist, call our crisis line at 1-800-273-8255, text us at 838-255, visit one of our vet centers, or access any VA mental health services online. We're standing by and we're ready to help, because mental health care is health care. As Secretary of Defense said so well last month, your mental health is your health, and your health is our top priority. Another major focus here is toxic exposures. We're not waiting for Congress to act on this. We're going ahead and acting ourselves, and we've already announced 3 major updates. 1, we're creating a new comprehensive decision-making model for determining presumptive conditions, a model that will be guided by one core principle: getting vets the benefits they have earned and therefore deserve. 2, veterans suffering from bladder cancer, hypothyroidism, and Parkinsonism due to Agent Orange can now be paid the benefits they're owed. And 3rd, we announced this last month that we will presumptively pay disability benefits to veterans who suffer from asthma, sinusitis, and rhinitis as a result of their service in Southwest Asia, Afghanistan, and Uzbekistan. Veterans have waited for these benefits for far too long, and we're doing everything in our power to make sure they won't have to wait any longer. Now, this is just the beginning, not the end of our efforts on toxic exposure, and we're moving ahead with urgency. Lastly, on outcomes, we're laser focused on ending veteran homelessness. You know, a few weeks ago at a homeless vets vaccination event outside VA headquarters, a veteran came to get a shot. He wasn't wearing any shoes. So we got him vaccinated, and our canteen staff got him a new pair of shoes. On the one hand, that story's heartwarming. A job well done. On the other hand, it's heartbreaking, because that man served our country. He should have shoes on his feet. He should have a roof over his head. In fact, there should be no such thing as a homeless vet. Not here, not in the greatest country on the face of the planet. So I assure you, through HUD-VASH, SSVF, the Emergency Rental Assistance Program, and more, we're going to do whatever it takes to help vets through the end of the eviction moratorium, to get them into homes, and to keep them there. Finally, excellence. We're seeking excellence in all we do for veterans by leveraging the strength and diversity that defines the veteran population, the American Legion, our VA workforce in this amazing country. Our diversity is a strength, never a weakness. Every person entering a VA facility must feel safe, free of harassment and discrimination, and we will welcome all veterans. One of my first actions as VA Secretary was ordering a top-down review of all our policies with the help of the Legion to determine how we can make VA a more welcoming place for LGBTQ+ veterans, women veterans, minority veterans, MST survivors, and more. Now, there's a lot more I could say on this, but it all boils down to this. For far too long, too many veterans have fought to protect our rights and our freedoms. And then they've had to fight brutal battles here at home for their own rights and their own freedoms. Tragically, some of those fights continue to this day. But at VA, those fights are over. Let me just repeat that. At VA, those fights are over. In this administration, nobody's going to have to fight to get the quality care, benefits, and services they've earned, no matter who they are or who they love. So that's where VA is headed, continuing to deliver more care, more benefits, and more services to more veterans than ever before, with advocacy, access, outcomes, and excellence as our defining principles. But make no mistake, we can't do this without you. Since VA began, we have needed your help and your leadership to serve vets, and that's more true now than ever before. The experiences and perspectives of the nearly 2 million American Legion members are a powerful resource. And when I think of just how powerful, I don't just think of the fact that you wrote the first draft of the GI Bill, or even that you advocated for the creation of the Veterans Administration itself. I also think about a story I heard the other day about an Army veteran named Meyer. After returning home from 2 deployments to Iraq, Sean struggled with addiction, depression, panic, and anxiety. War will do that. He said, I knew I needed help, but I didn't know who to reach out to. Then he found you. He didn't feel safe leaving his house, so you went to him. You did his paperwork. You helped him through the process, and you got him a 70% disability rating. But if you ask him, that's not the most important thing you did for him. The disability rating is nice, he says. But I learned a long time ago, money won't buy you happiness. The most important thing, in his words, you gave him hope. That's what you do, and that's what you have done for 102 years. You give veterans hope. So when I said earlier that we're in a position where we have to fulfill the promise that the country makes on behalf of those veterans, that's what I mean. That's what I mean. So I thank you again for the opportunity to be with you today. God bless the Legion. God bless the United States of America. And God bless our veterans, their survivors, their caregivers, and their families. And may we always give them our very best. Thank you all very much.
Mr. Secretary, thank you for your remarks. I'd like to ask VA&R Chairman Ralph Bozzella to join us. Sir, we have 2 prestigious awards we'd like to present. The first is our Distinguished Physician of the Year. The second is our Distinguished Healthcare Provider of the Year. We intended to present them at our Washington conference, but had to reschedule because of the pandemic. The citation on both of these plaques are the same, so I will read them as one. The Distinguished Physician of the Year is to all Department of Veterans Affairs physicians. The Distinguished Healthcare Provider of the Year is presented to all Department of Veterans Affairs healthcare providers. The award are given in recognition of your distinguished public service and commitment to the care of America's veterans during the 2020 COVID-19 global pandemic. Your daily selfless acts of courage caring for our nation's veterans demonstrate your high degree of professionalism and countless hours dedicated to ensuring veterans are treated with respect while receiving exceptional health care. Signed by Ralph P. Bozzella, Chairman, National Veterans Affairs and Rehabilitation Commission, along with myself, National Commander. Mr. Secretary, please accept these awards on behalf of a grateful American Legion and tell your doctors and health care providers, job well done.